Hello, I am Dr. Alan Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I am not your typical surgeon who does cosmetic surgery. I take care of wounds in people's homes. This means that I take care of people who are homebound and bedbound, who have wounds, who cannot go to an office or a hospital. The most important thing I do is facilitating families and empowering them to help heal their loved ones' wounds. I work with the family members, the caregivers, the patients and the primary care physicians, as well as the nurses. In this series of videos that we're going to be doing over the next few weeks, we're going to talk about important concepts. The most important thing I go over with families is what I call the 4 Ps. Number 1 P are prayers. It doesn't matter what religion you are, Islam, Christianity, Judaism, you have to believe in something. Whether it's God, Hashem, Allah, Napoleon, Batman, you have to believe in some higher power that is more important than you. The second thing is prayers. Is plenty of love, meaning that you have to be really focused on your loved one. If your loved one is homebound and bedbound in their own home, you have to be present, meaning you have to see them on a regular basis, facilitate all the processes, which includes helping the caregivers, really paying a lot of attention. When patients are alone, they don't do well. A lot of my patients during COVID who were isolated did not do well. A lot went from being ambulatory to being bedbound and did not thrive. Unfortunately, the cousin of my wife in Israel was isolated and ended up deteriorating significantly, that she ended up being admitted to a rehabilitation facility requiring a feeding tube via the nose, and subsequently died due to all these complications and morbidities. The third P is protein and nutrition. We can't emphasize enough how important nutrition is. And I'm not talking about Ensure, which is a processed can, which we'll go over in future videos. We really have to make sure the patient is getting food. If they have a feeding tube, then we have to focus on trying to give them really quality feeds, such as Kate Farms, as opposed to Ensure and other things that are very processed. If they're eating, then and they have difficulty chewing, then we can puree the food. There's high protein foods such as salmon, fish. I try to focus on non-meat products. Not saying that I'm against meat, but I do think red meat can be deleterious to cardiac health and other things. You can even puree hummus or beans and give it to them. The 4th P in my series of 4 Ps is pressure relief. So really, like, the most important thing, the reason why I see patients is they're not being turned or they're sitting in a position for too long. A lot of patients, when they go to a place of worship, they're sitting in a wheelchair for 4 to 6 hours, which is a big problem. If you're not able to move by yourself, you end up creating enormous pressure on areas that are either thinned out due to lack of muscle growth, strength and tensile strength in skin, and subsequently a pressure ulcer can develop. So when a pressure ulcer does develop, we don't want it to get worse, and if we're going to heal it, we have to eliminate the underlying source, which is pressure. So this is a brief introduction video of what I do in my practice to help patients who have wounds, whether they be pressure ulcers, vascular ulcers, traumatic ulcers, skin cancers. My goal in these video sets is to really educate families, patients, caregivers, loved ones, as well as primary care physicians and nurses, and how to help the patient and the family really navigate this process and to empower them to be able to heal at home and not rely on other systems. Thank you, and that's the end of the first video.